Hi familia, welcome to the Alcohol Skills Training Program workshop as a part of your risk management training. I'm Annalie Martinez and I'll be conducting this video today. So the goal of this part of the course is really to build your knowledge on everything about using substances safely, some harm reduction, and also highlighting APsi Lando's policies. And of course, this is not us telling you you cannot drink, it's just making informed choices. So again, the philosophy of this program is from a harm reduction lens. So basically, we're going to focus on all the ways that you can engage in harm reduction. What does that mean? What does it look like for different situations? We want to meet you where you're at and give you information that can help reduce any kind of potential harms when you're drinking alcohol. And again, this is your choice. We just want you to be as safe as possible. So first and foremost, what is alcohol? So of course, we know alcohol is clear, vaporous, flammable liquid. Alcohol is a liquid byproduct of fermentation. We love all the science parts of this. But most importantly, in terms of drugs, it is categorized as a depressant. So if you've never heard of a depressant, what it is a substance that impacts your central nervous system. Some potential side effects that are positive with this is pain relief, euphoria, increased relaxation, sociability. So those are some of the reasons that we tend to drink, right? We want to feel those good things. But of course, with every positive, there's a negative. So some of the negatives associated with misuse or overuse of alcohol is, of course, slurred speech, loss of coordination, lowered inhibitions, lowered blood pressure, slowed breathing, and an increased likelihood of injury. So those are things that you probably have heard of when you get drunk. But of course, there's also the potential for abuse and other health complications long term if you are misusing it for a long period of time. So our first harm reduction tip, sticking to one substance. So if you're drinking alcohol, you're just taking alcohol. Nothing else is going into your body. So alcohol with other depressants, as we said just a second ago, depressants are downers. So if you take another depressant with alcohol, Xanax, painkillers, cough medicine, those kinds of things, you're only doubling that effect, which puts you at a high risk for overdose. We don't want that for you. And as a little side note, when it comes to cannabis, well, cannabis does not have as high of a risk when it comes to combining with alcohol. It does still increase that depressant effect. So no crossfading here. Then we have alcohol and stimulants. So if alcohol is a depressant, depressants bring you down. Stimulants is the opposite. They rev you up. So think caffeine. So essentially, the reason we say not to mix those is caffeine and any kind of stimulant has a tendency to hide the effects of alcohol. So basically, if you're used to knowing, okay, after 2 drinks, like I start to, feel a little loose, I feel a little happy, giggly. Caffeine isn't going to have you feeling those same things. It's going to make you feel like you are okay, even though the alcohol is still in your body, still impacting you. You just won't feel it the same way and you won't feel it as soon. So that might lead you to drinking more than you would because you thought you were good. So on the last slide, I mentioned cannabis. So is cannabis a stimulant or depressant? It's none of the above. It's a cannabinoid. It's its own fun little group. Cannabis can sometimes have the same kind of responses and effects on our body as depressants, stimulants, and hallucinogens. So we love that trifecta. While I mentioned before, cannabis and alcohol do have a lower risk when it comes to what they do to our bodies when they're combined. One substance by itself is still better than 2. And so, again, this harm reduction tip is really just sticking to one thing at a time. More alcohol basics. So alcohol's journeying through your body. So of course, you're drinking, it's going through your mouth, down your esophagus, into your stomach. That is where we start to absorb some. Then it makes its way into your small intestine and then into your bloodstream. Once it makes your bloodstream, it's going into that brain. And that's a process that takes about 5 minutes. It does not take an hour for your brain to start processing that you have been drinking. But it does take about an hour for your liver to metabolize any one standard drink. And we'll get into that a little bit more. So since we're talking about alcohol absorption, what factors impact that? So your sex assigned at birth, your weight, the actual concentration of the alcohol, and how many you're drinking per hour. All of that impacts our blood alcohol levels and what we feel when. So of course that's different for every single person. You can't apply how many drinks affects me to your friend because all of these factors. So the average serving of alcohol by volume for our three main categories. Our beer is always about 3 to 12%, wine is about 12 to 18%, and distilled spirits or liquors is always between 12 to 60% alcohol. So I mentioned standard serving sizes. That is not the amount of alcohol actually in what you're drinking. Standard serving is how much you're pouring out. So for beer, it's 12 ounces. Micro beers or craft beers is 10. Cider is 10. Hard seltzers is also 10. Malt liquor is 8. Canadian beer, 8. Ice beer, 8. Malt liquor, 6. Um, some high ethyl alcohol drinks like Four Loko would be about 4.5 ounces, so less than what comes in those Four Lokos cans. Wine is 4 to 5. Fortified wine is 2.5. 80 proof liquor is 1.25 ounces, and 100 proof liquor is 1 ounce. And we'll get into what that proof means if you don't know. So another harm reduction tip is knowing standard drinks. I just read you a very long list. I do not expect you to know and remember anything off of there. But also, I am a visual person. I could not tell you how much 12 ounces looks like in a glass. And of course, different shapes of cups, different glasses affects how much like it really looks like we're pouring in there. So the best way to do this is if you ever have a solo cup, and I mean the actual brand, not the Walmart knockoff, the actual solo cup brand, all of those lines mean something actually. So if you look at this picture here, the very first one from the bottom is a standard size of liquor, so that 1.5 ounces. That second line is wine at 5 ounces. About halfway or so is malt liquor. And then the third from the top is your 12 ounces of beer. So now you know that those lines actually mean something. So we're going to get into like what I meant when I said like 80 proof, 100 proof liquor. So with this harm reduction tips, it's reading the labels. Sounds simple. A lot of us don't do this though. You get a drink that you like, a bottle you like, you're not looking at what it says. So if you look here at the examples, you can see like with this White Claw, it says 5%. So you know there's about 5% of alcohol within this whole can. The word proof, actually, you just double how much is in there. So if the bottle says 40% alcohol, it's 80 proof. If it says 50% alcohol per volume, then it's 100% proof. So that's all that really means, is just telling you exactly how much alcohol is in the liquor itself. So now getting back to our blood alcohol and how our body absorbs alcohol. So sex assigned at birth, and the reason that factor is really important is because the sex we're assigned at birth determines how much of the enzyme that is in your liver, which helps to break down that alcohol. So the more you have, the faster alcohol leaves your body. The less you have, the longer it takes for your liver to break that down. So male bodies tend to have more of this enzyme than females. So that's just a little quick, fun, sciencey fact, but that is why that matters. Again, I keep talking about this blood alcohol content, this BAC. What is it? So it is the percentage of alcohol within a person's bloodstream, or not bloodstream, your blood. BAC rises as you get more alcohol into your body. So of course, if you're drinking a lot faster, this is where that factor comes in, you're gonna have a higher BAC. because your body can only break down so much, so it's not getting it out of your blood as fast as you're putting it into your body. And why is BAC important? This lovely little chart. So depending on where your BAC is, this is the kind of effects you're going to be feeling. So at a 0.0, of course, you're normal, you're fine, nothing is happening to your body, there's nothing changing, right? At 0.02, at that point, that is where if you are under 21, you cannot drive. That is illegal. At 0.04, that's where that, like that little buzz, that euphoric feeling starts to hit. At 0.06, that's where you start to see your brain starting to fail you and you start to feel all of the effects beginning. And 0.06 is also what we like to call our point of diminishing returns. Basically, the more you drink, it is not going to make anything better. It's like the point of no return because there really is no going back to that happy spot. So 0.08 is where you have impaired judgment, you feel nauseous. It is at this point you are at like that legal limit of intoxication. 0.10 to 0.15 is where that's where you start to see someone is truly like tripping over themselves, the slurred speech, all of those effects. 0.15 to 0.25 is where we see blackouts occurring. 0.25 to 0.35, someone is passing out, they're in and out of consciousness, there is a risk for death, and of course, 0.4 to 0.45, it is lethal dose in most cases. That is where you need serious medical attention. So BAC is very important to keep track of to know if you're really okay. So getting back to this point of diminishing return, so less is more. And it really is for alcohol. So this green little spot that you see on the graph, that is the happy spot we would like you to stay at. If you're drinking, that's where everyone wants to be. You want to feel good. You want to feel social. You want that like happy little buzz feeling. You don't want the migraines, the hangovers, the blackouts, any of those things. So you want to stay in this green zone. So alcohol is what we call biphasic. There's just two phases to it. You're happy, you're good with these low doses of alcohol in your blood system, and then you have all the negative things after you hit that point of no return. So that's just something to be aware of. The more you drink, it's not going to make anything better. There's no going back to that happy little green zone. It's only going to get worse the more you drink. So that is something to keep in your mind. So just a little quick rundown about alcohol and your BAC. So of course, 90% of alcohol in your blood is metabolized by the liver. It takes about an hour for your liver to break down one standard drink. 10% is eliminated through your lungs or urine. So that's where there are times where like you're interacting with someone and you can literally like smell the alcohol like in their breath. That is their body getting rid of that 10%. If you drink alcohol at a faster rate than your liver can break down, your BAC is going to go up. We've talked about that. So, which is why we're going to get into some more harm reduction tips on how to keep your BAC low. And I know there's all these things about like if your BAC is high, if you're feeling drunk, like drink some coffee, take a cold shower, it's going to sober you up. No, it won't. It won't. The only thing that's going to sober you up is time. So if you have a peak BAC of 0.08, it's going to take you 5 hours to get back down to zero. From 0.16, it takes about 10. From 0.24, it takes about 15. So this is, 5 hours. That's about most of your, like you can sleep it off, wake up the next day, right? 10 hours, could possibly still sleep it off depending on what time you go to bed. 15 hours, that is like the rest of your night and a good chunk of the next day that you are sobering up. So you might still feel good to go, but you still are processing that alcohol. And this is where tolerance plays a really big role. So there are 3 types of tolerance when we talk about alcohol consumption and just substance in general. So there's dispositional tolerance. So that is you genetically have a higher tolerance. So it'll take a lot more for you to feel that buzz. Acquired tolerance is what a lot of people tend to have, where your body just gradually gets used to how much you're drinking, how much you're taking in, and so it builds up that tolerance. And then the last one is behavioral. So it's not necessarily that you are not affected. You are. You just have learned how to compensate for all of the ways that alcohol impacts your body. So tolerance is a big thing of masking, similar to stimulants. Those effects of alcohol where like you might think you're okay and you might have a high tolerance. It does not mean that your BAC has not gone up. It just means that on the outside, it is not affecting you. But internally, your BAC is still up. So of course, the biggest takeaway from that is that alcohol tolerance isn't sobriety. So just because you feel sober doesn't mean you are. Because you can feel okay, you feel like you're good to go. It's okay to drive. It's okay to like go on with your day. But that doesn't mean that your BAC is at 0. So it's just something to always keep in mind when you're out drinking or when your friends are drinking, anyone that's close to you, that just because they might look okay does not mean that they are. So then another harm trick, so just understanding what the risk of tolerance is. So you're spending more money on alcohol to get that buzz because you have a higher tolerance. You're putting stress on your body because your poor liver is working overtime. And you're drinking to chase like that buzz. So the more that you drink, you're really just getting all of those negative effects that we don't want. You might become really overconfident with yourself and what you're able to do while you're drinking or once you're done drinking because of that behavioral tolerance. And so you might take some risks that you wouldn't normally take, but you can end up harming yourself or someone else. And of course, it also increases the chances of you becoming alcohol dependent, especially if you have that dispositional tolerance or that family history of alcohol misuse problems. So these are just things, again, to keep in mind. So some harm reduction tips for preventing drinking and driving. First and foremost, a DD, designated driver. Plan this ahead of time. You know when you're going to go out drinking, or for the most part you do. If your friend is so amazing that they will come out anytime and just drop what they're doing and go get you, amazing. Don't expect that. Don't put that on them. Plan ahead. Getting an Uber or Lyft, also a great option. Letting someone know that you're going out and to pick you up at a certain time. So maybe your roommate, your friend, a family member knows, okay, you're going to be at this bar or this club, whatever. Okay, you want to leave by 10, I'm going to come get you. Like whether you've been drinking or not, it's a great way to make sure you're getting home safe with someone you trust. And of course, another one, if let's say you're within walking distance of your home, make a plan to walk home with someone who's sober. Again, kind of like a DD, but they're just making sure that you're not getting lost, that you're making it home safe, nothing happens, you don't fall, trip, anything. So always have a plan. So now we're going to get into some of the heavier topics. So alcohol overdose, what is it? So you might know it as alcohol poisoning. It's the same thing. So it's really you're drinking so much that your BAC is that high, it's potentially fatal. You will need a medical intervention. It's not something you can just sleep off and feel better the next day. You need medical help. So some of the risk factors for alcohol overdose include whether you've eaten or not, because drinking on an empty stomach, there's nothing there to help your body break up some of the alcohol that's in your system. Of course, we talked about tolerance, your sex and weight, the rate of consumption, and if you've had any other substances, those stimulants, other depressants, cannabis, all of that. Important to know the symptoms of an alcohol overdose. So first is vomiting while unconscious or semi-conscious. I am not saying vomiting in general because you could not be experiencing an alcohol overdose and throw up, right? It's really once that person loses consciousness or they're coming in and out of consciousness and vomiting. If they are cold, clammy, blue lips or nails, so think Twilight Vampire, they're experiencing alcohol overdose. Irregular breathing. And when I say irregular, I mean for that individual. So if you know, for example, that your friend normally breathes really heavy and all of a sudden you can't hear them breathing, that's not normal for them, right? Or all of a sudden you hear that heavy breathing or fast pace, something that's not normal for them. you need to get them help. But what does help look like? So we have the 3Cs: check, call, care. So checking, of course, first and foremost, you're looking to see for any of those symptoms, making sure, you know, are they, if they're, semi-conscious, seeing like what is their, awareness. Are you able to wake them up if they're unconscious? Call, you are calling 911 because they need medical attention. But you're also, if you're unable to call 911 or you don't have a phone, if you've ever done CPR training, then you know that you want to put the pressure on someone else, point them out, whether you know them or not. If you don't know them, pick whatever article of clothing, that hey you in the red dress, I need you to call 911 to ensure that medical attention is on their way. And the last one is care. So you want to stay with that person until help arrives. Something else you can do is, and I'll go over this on the next slide, is putting them into the recovery position, just to make sure that they're not choking on anything, that there's nothing obstructing their airway until help gets to them. So this is steps to putting someone in the recovery position. So if they're on their back, you're going to want to put their arm into like a little right angle next to their head. You're going to take the other arm, cross it over their chest, grab the leg that's furthest from where you are kneeling next to them, bending it, and that'll make it as easy as possible, like regardless of, size difference, weight, any of those factors, to pull them onto their side. And again, that's going to keep their airways nice and clear until help gets to them. So we're going to go over a bunch of different harm reduction tips. So one of them is avoiding mixing alcohol with other substances. We talked about that a lot. Eating prior or while you're drinking, keeping track of how much you're drinking, spacing and pacing your drinks, which basically means either I am alternating between an alcoholic and non-alcoholic drink. Maybe I am babying this drink until I finish it. I won't order another one because then I don't feel rushed to start another drink. I might be just like, I'll take a drink, wait 30 minutes or so, then I have another one. Avoiding or altering drinking games. So of course you can still play the games because we love the games are fun, but using non-alcoholic drinks. Avoiding trying to outdrink someone. Again, we talked a lot about everyone's, drinking habits are different. Everyone's BAC is different. So trying to outdrink or keep up with someone is not going to do you any favors. Setting limits and letting your friends know that, so that they can help hold you accountable and help you stick to it. Having a designated driver, setting money aside for a ride, and knowing what's in your drink. Avoid accepting a drink that is open, that you don't know what's in it, because of course you don't know how much alcohol is in it, what types of alcohol, if there's any other substances, etc. You want to make sure that, either you're serving yourself or you're getting it for someone where you can see what they're putting into the drink.